Hello everyone. So in this video we're gonna be doing a search using first our clinical scenario 1 using Medline. So in this scenario it says that in teens trying to quit smoking, is cognitive behavioral therapy more effective than nicotine replacement therapy? And so in this question is a therapy type of question because we're comparing cognitive behavioral therapy to nicotine replacement therapy in allowing teens to quit smoking. So the population in this case, or the P, is teens. The intervention is cognitive behavioral therapy. The comparison is nicotine replacement therapy. And the outcome is quitting smoking, or in other words, smoking cessation. So I'm going to go first to university libraries, which is reached by aub.edu.lb, and then you press on libraries. And then we're going to go to databases, and we're going to search for Medline. Okay, and with Medline R. And so for our first search, we're gonna start with our intervention. So cognitive behavioral therapy. So we've located a mesh, but to make sure that it consists of the right information. And so under this mesh, we have minor meshes of acceptance and commitment therapy, cognitive restructuring, and mindfulness, which could be seen as part of CBT. So I'm gonna explode in this case and continue. I'm gonna not select any of the specific subheadings, so we're gonna go with all of them. So we'll continue by default. Okay, so we have our first term. Now for the second, so we were going with nicotine replacement therapy. And so in this case, located the tobacco use cessation devices. So let's check that. Okay, and it has the nicotine chewing gum, which is also, so I'm gonna explode in this case since it's the only one under it. Also including all subheadings. And so usually you don't have to search for the outcome in therapy questions. You search for the intervention and the comparison, and the outcome should be there. But in this case, I'm gonna include it as well. And this is to make sure that the papers that we do find have the outcome, and as a result, we're gonna have a smaller sample of papers to go over in the clinic quicker. So here we have smoking cessation, and we have smoking reduction, which is not the same. We need someone to quit smoking. And so tobacco use cessation is also the same as smoking cessation. So I'm gonna also continue here. Okay. And so now I'm gonna end all of these. And we have 62 results, but still we need to add our population. So I'm gonna go to limits, additional limits. In this case, we have teenagers, which is the same as adolescents. And we're also gonna look in the clinical queries. Since this is a therapy, I'm gonna start with maximizing sensitivity. And depending on the number of our results, I might later on maybe change the filter to increase specificity so that we get less results, but the results are going to be more meaningful, and we're going to talk more about the topic and not just mentioning the topic. And so we get 9 results in this case, which I believe is a great number to sift through easily in the clinic if we have a patient that we need to help with such a case. Thank you.